Doctor, welcome to EPOMEC 11, and I believe you just finished your speech about the pinhole technique. Can you please elaborate a little bit more?
First of all, I'd like to say the EPOMEC conference is such a huge conference with more than 4,000 delegates coming from all over the world, and with a strong faculty organized by Dr. Saleh and the others. I think that's phenomenal. Second thing is, when someone has got, let us say, keratoconus or radial keratotomy incisions done, or a pellucid marginal degeneration, or a corneal scar, the answer is a very simple technique we follow sometimes called a pinhole surgery. In pinhole surgery, we are doing a pinhole pupilloplasty. So we make the pupil approximately about 1.5 millimeters. We have designed a pinhole device with the help of Jack Holliday and Epsilon Company. And what we do is we keep it in front of the eye. It has got various apertures in it, 0.5, 1, 1.5. So ask the patient preoperatively what aperture he likes. Let us say he wants a 1.5 millimeter pupil. We will make the pupil exactly 1.5. What the pinhole pupilloplasty does is it blocks all the peripheral rays of light. The rays of light only in the center go through, and that's why the patient sees. Another simple thing for all the delegates who are watching is this. If you take a 6 diopter cylinder and keep it in front of your own eye, you'll see nothing. You're blind. Make another 6 diopter cylinder, that means 12. You'll be practically blind. Now, in front of that, keep a pinhole, you'll start seeing. So that is where the advantage comes. Another important point is the word aberropia. You see, when these people have high aberrations, we coined a terminology in 2002 called aberropia. Like you have myopia for minus power, hyperopia for plus power, we have forgotten patients can have aberrations in the eye which are higher order, which cannot be corrected. These people are called aberropic or aberropia. The solution in aberropia is, if I make the pinhole 1.5, I've cut off all the aberrations and the rays of light will go through and through. A normal higher order aberration for a human being is 0.3. So I advise everyone to go on the Pentacam, check the holiday Pentacam report and see, you see patient with 1. If it is below 1, you're okay. But anything above that, then that is significant. The maximum I've seen in a patient is 109, who had come to me from Bangladesh, who had 109, and we made that patient with pinhole surgery 2020 J1 or 66 N6 without glasses. Because the advantage in this is they see distance and near without glasses. And that's the bigger thing. The last thing which I want to mention here is, if we see the retina, we have rods and cones. Now understand one thing, in the fovea, we have only cones. Now the cones are slightly obese, the rods are thin. So how can the fat, obese cones fill into a small space? What the Almighty has done is, He's made the cones as cones, but He's made them thin, like rods. So when a thin ray of become like that, the rays of light go in like this, through the cones and reach the retina in the back, right up to the edge. And that's why they see. So all in all, if you have patients post-dark not seeing, post-PKs, keratoplasties, keratoconus, radial keratotomies, pellucid marginal degeneration, or corneal scars, all these cases, the answer could be very simple technique called pinhole pupilloplasty or pinhole surgery.
Thank you very much, Doctor, for the lovely explanation. I, who doesn't know anything about the eyes, I kind of understood the whole
Thank you
technique.
very much. And
It
I'm
makes a
sure your
lot.
doctors listening to
Definitely.
this will listen, will and understand it. And I have to congratulate you and the entire EPOMEC team for doing such a great job.
Thank you very much.
Thank you very much.
Appreciate it. Thank you.
Namaste.
Namaste.